Welcome to Innovators, a series where we sit down with leaders across the healthcare industry to talk about some of the biggest trends that are impacting the space today. My name is Justine Giancola, and I'm on the corporate communications team here at Inovalon. And joining me today is Dr. Paige Kilian, our Chief Medical Officer at Inovalon. Thank you so much for being here today, Paige.
Thank you for having me, Justine. I appreciate it. This is important.
It is. So today we are actually going to be talking about mental health. May is Mental Health Awareness Month. This is it's a very important month. There is a lot to be said, a lot to be studied on mental health, and I think you are the perfect person to help shed some light on this topic. So getting started today, we know that it is an important topic. Millions of people across the world struggle with mental health challenges. As a physician, what strategies have you noticed to be the most helpful in kind of overcoming and managing some of these challenges?
I think the most important thing is awareness. You said it. Millions of people are affected. So making sure that people know you are not alone. These conditions are extremely common, particularly mood disorders like depression and anxiety. In our country, 1 in 4, probably more adults face mood disorders at least. You are not alone. And understanding what it means. What are the symptoms? So I think it's kind of intuitive what anxiety is, and people understand depression means you're sad, but it's really more than that. They're both more than that. There are other symptoms associated, like lack of motivation, lack of the ability to concentrate, an inability to take pleasure or interest in things that normally make you happy or things in which you're normally interested. Poor sleep, fatigue, change in appetite. You can gain weight, you can lose weight, you can, be hungrier, you can be less hungry. Irritability, often that's apparent to others. And the severity of what you're facing is determined by how many of those symptoms you have, how often you have them, and over what time period you've experienced them. So understanding the symptoms, critically important, but also understanding that these conditions are treatable. And they're treatable with non-pharmacological intervention and with pharmacological intervention. So on the non-pharmacologic side, there are things like behavioral modifications. So improving sleep, and I want to talk more about that because it's really important. Getting more exercise, reducing alcohol intake. Alcohol definitely affects your mood. It also affects your stress hormone levels, which brings me back actually to sleep, because one of the reasons that adequate sleep is so important is because without adequate sleep, your stress hormone levels go up. That can influence certainly your appetite, your weight, and your mood. How do you get better sleep? You improve your sleep hygiene. What does that mean? It means sleeping in a quiet, darkened room. Turn the radio off, turn the television off, reduce your alcohol intake again, right? Reduce your caffeine intake. Don't drink a lot of fluids right before bed. Get good sleep. It makes much more of a difference than you might think. Other non-pharmacologic therapies are counseling, right? Interpersonal counseling, cognitive behavioral therapy. There are lots of options, and there are good medications. And so one or more of these modalities, one or a combination will help. You can be treated. And there are really good options. So I think those are the ways to overcome some of the challenges, at least.
Absolutely. And there has been sometimes it seems like there might be this stigma around getting help and looking for help. And, I would love to see, and I think there's already been a huge change in kind of getting past that and people being more open to saying, mental health it's real, it's here, and there are ways to fight it. So I think that's great. And this kind of leads into the next question of you obviously have experience in this area. What are some of the misconceptions around mental health? And how can we start to break those down?
So this, I think, ties into the first question as well. The whole "you are not alone" thing is really important. People feel isolated, and it's part of the condition itself. that isolating feeling. So it's the condition causes you to feel isolated. And then because unfortunately in our society, there is some mystification, there is some stigma around this, people tend to become more isolated. So the whole recognizing you're not alone thing, but also recognizing that the management of mental health conditions is not one size fits all. And there is, as I mentioned, the non-pharmacologic therapy, there are pharmacologic therapies, and in fact, the non-pharmacologic therapies, which I think, there are kind of two schools of thought for patients coming in. Some people are very open to therapy and don't want medications, and some people are like, just give me a medicine, I don't want to see a therapist. The reality is combination is probably the most effective. And there are data to support the fact that the strategies that you acquire through counseling, through interpersonal therapy, through cognitive behavioral therapy actually have a longer benefit, have a more lasting benefit than many medications. So you don't have to fix it yourself. You're not alone. And there are lots of ways to tackle it. You can get to what works for you. Talk to your doctor. Talk to your doctor.
Okay. And you have the medical experience. You also have been in this corporate environment now. What do you think that employers, so we know what we can kind of do as individuals, what do you think employers can do to take meaningful steps to, foster an environment that supports mental health?
Well, I think recognizing and celebrating, acknowledging Mental Health Awareness Month is certainly a start. That's important. Raising awareness, educating people, absolutely a start. Critically important for employers is to provide good behavioral health benefits, provide resources, and educate your employees on how to access those resources. I think there's also a role for some of the wellness initiatives that different corporations do. I think they're important. Remember, stress hormones are harmful when chronically elevated, and when you're not in a fight or flight, a true fight or flight response where they help you escape, they're harmful. They're detrimental to your mood, to your overall well-being, to your overall health. So are there wellness initiatives that can help? Certainly. So, yoga programs, mindfulness programs, exercise programs, walking clubs. I think these are good initiatives to go along with the other things. I also think emphasizing the importance of taking your PTO. Take your PTO. Encourage your employees to use that benefit. And then I've got to come back to raising awareness and having those good behavioral health benefits and showing people how to access them.
And, I think which kind of leads me to my next question. This is not so much on the employer side, but we're saying you're not alone. Reach out, raise your hand. But what other maybe more tangible resources could someone look for if they're struggling?
So this is not a technical response. Talk to people. So we've said this is incredibly common. Most important thing to do, of course, is talk to your doctor. Talk to your doctor. However, some people have difficulty accessing their physician. They don't have a relationship with their doctor, their nurse practitioner, their PA. That needs to be built. Start by talking to your friends. Talk to human resources. The number of people who encounter this struggle is so large that when you start a conversation, you find people who have faced exactly what you're facing. So it takes a nudge, it takes some courage, right? It takes making yourself a little bit vulnerable, but talk to your friends, talk to your family, talk to human resources, talk to your doctor, bring it out into the open, and those resources are available to you, either your own doctor, either through your employer, or in your community that are accessible, and your friends and colleagues and family know where to go. So there has to be conversation about this. And that's critical also to overcome the stigma in the first place. So it takes some courage on everyone's part. And I can't say strongly enough how much I encourage people who have successfully navigated this to be willing to share your story. You think about what it would have meant to you if someone had given you that hand. I mean, even if it's a phone number, even if it's a she's a great doctor, even it's a hey, I talked to my human resources person and this is what she told me, talk to yours. So, lend a hand, ask for a hand, talk to someone.
And I think this conversation is becoming it's becoming more prevalent. In the last few years, even in the workplace, even in personal relationships, this conversation of mental health, how important it is, and that people are coming forward and admitting, not that it's anything even to admit, but that are willing to have these conversations seems to be, anecdotally speaking, seems to be becoming more common. So
Agree.
that is promising.
Yes.
Now, in the area of, just the healthcare space, do you think there are improvements that the healthcare industry could be making? And I guess kind of to the way that we approach mental health as a society. What can the healthcare industry be doing to support that?
So the answer is yes. I think there are ways that we can improve this. I'm passionate on this. We have to now. So here we are. It's Mental Health Awareness Month. We're talking about education. We're talking about awareness, mental health, mental health, mental health. We need to stop separating mental health from physical health. It's all health. And when we separate it, even though I know it's a means to an end right now, but it only furthers the stigmatization, in my opinion. You know, if you have a chemical imbalance in your renin, aldosterone, angiotensin system, you have a dysregulation, you have hypertension, you have high blood pressure. And do you know how you manage that? You manage it with non-pharmacologic and or pharmacologic treatments, right? You get exercise, you change your diet, you reduce alcohol intake, and you consider medication, maybe more than one. Maybe you do all of it. Okay? When you have a chemical imbalance, a dysregulation in your dopamine, serotonin, norepinephrine system, pardon me, you get mood disorders. So how do you manage those? With non-pharmacologic approaches and pharmacologic approaches. These are parallels. When we think about them as distinct entities, mental health and physical health, it does no good to the mental health side. So it's all health. Recognize that and so that's what the healthcare industry has to do. And I think what we have to do as a society is the same.
Well, I mean, when you said that, and not that I have heard people kind of talk about this a little bit, but when you said we need to stop separating mental health from physical health, I mean, I got chills. It's so true. It is all health. It is all wrapped in to our overall health as individuals. So, um, completely agree and look forward to seeing kind of how the healthcare space evolves around making mental health, really a priority. Um, Paige, I have really enjoyed our very short conversation. Is there anything else that you want to add? Anything before we sign off here today?
You're not alone. Talk to your doctor.
Okay, Paige, thank you so much for being with us today. For everybody who tuned in today, thanks for joining us, and be sure to stay tuned for our next session of Innovators. Thanks, Paige.
Thanks.